Measles is a highly contagious respiratory disease caused by a virus spread through contact with an infected person, or more commonly, via droplet transmission. In 8 to 15 days, infected patients show cold and flu symptoms, followed by a rash which begins on the head and spreads to the extremities. Inside the mouth, white lesions called Koplik spots appear, but fade as the rash develops. Most people recover, but in about 1 in 15 cases, complications can arise. These include infections of the ear, bronchitis in the respiratory tract, pneumonia in the lungs, and encephalitis or inflammation of the brain.
We're going to do our presentation on measles. I'm Kirsten.
I'm Emily.
I'm Lindsay.
And I'm Erin.
All right, so what we're going to be talking about is kind of like what the disease consists of, as well as the symptoms, how to prevent it, and what the vaccination schedule is for. Tabor's Dictionary and Omnio defines it as a highly communicable disease caused by a rubella virus marked by fever, general malaise, sneezing, nasal congestion, brassy cough, conjunctivitis, spots on the buccal mucosa, and then a eruption over the entire body, and that's that rash that the kids get.
A brief history of measles is in 1912, measles became a nationally recognized disease in the United States. During the first decade of reporting measles, there was an average of 6,000 measles-related deaths. Before the vaccine became available in 1963, most children got measles by the age of 15. The CDC website states it is an estimated 3 to 4 million people in the United States were infected each year. Also, each year, an estimated 400 to 500 people died. 48,000 were hospitalized, 4,000 suffered encephalitis, which is the swelling of the brain from the measles disease.
The history continued for the vaccine. It was developed in 1954 when John F. Enders and Dr. Thomas C. Peebles isolated measles from a blood sample from a 13-year-old who was infected by the disease. In 1963, they developed a licensed measles vaccine. Following after that, in 1968, the strain of measles virus was transformed into an improved and weaker vaccine by Maureen Hilleman and has been in use ever since in the U.S. Now the measles vaccine is combined with mumps, rubella, and varicella.
Okay, and to continue with the history for the elimination part of it, the CDC set a goal to eliminate measles by 1982. Although this goal was not met, the infection and spread of measles reduced dramatically. In 1989, the second dose of MMR vaccine was recommended for all children, and the incidence declined even further. And in 2000, measles was declared eliminated in the U.S.
And then for the incidence, measles is one of the leading causes of death among young children. Unvaccinated children and pregnant women are at the highest risk due to their weaker immune system. Even though it was declared eliminated in 2000, there was a recent outbreak in January of 2015 where 84 people from 14 different states were reported to have measles. The virus is more common in undeveloped countries because they don't have access to the actual vaccination.
So how is measles spread? The highly contagious virus can be spread through coughing and sneezing. The virus can live up to 2 hours on the surface or airspace where the infected person coughed or sneezed. Infected people can spread the virus 4 days before and 4 days after the rash appears. The disease is a human disease and does not occur in animals. The CDC website states, measles is so contagious that if one person has it, 90% of the people close to that person who are not immune will also become infected.
The clinical manifestations of measles, the signs and symptoms are usually appearing after 10 to 14 days after exposure to the virus, and most victims exhibit signs of fever, dry cough, runny nose, sore throat, and conjunctivitis. The infection occurs in stages: infection and incubation for the first 10 days after you're infected. The virus incubates after the first 10 days. You have no signs or symptoms of the virus at this time. Non-specific signs and symptoms are usually measles typically begin with a mild fever, cough, runny nose, or conjunctivitis. The acute illness and rash occurs next, and that's small red bumps start to appear on the skin, and usually the face breaks out first along with behind the ears and the back of the hairline. And the last process is a communicable period, and that's when a person with measles can spread the virus to others for about 8 days.
they should take these two precautions. One is isolation, because measles is highly contagious from about 4 days before to 4 days after the rash breaks out. People with measles shouldn't return to activities in which they interact with other people during this period. Another thing that they could do is get vaccinated. Be sure that anyone who's at risk of getting the measles disease, who hasn't been fully vaccinated, receives the measles vaccine as soon as possible. Non-immunized people, including infants, may be given the measles vaccine within 72 hours of exposure to the measles virus to provide protection against the disease. If measles still develops, the illness usually has milder symptoms and lasts for a shorter time. Also, to continue with that, the vaccination schedule, 2 doses are needed for complete protection. The first dose is at 12 to 15 months of age, and the second dose can be given 4 weeks after that, but is usually given before the start of kindergarten at the ages of 4 to 6.
The prognosis of the disease, there's no treatment that can actually get rid of an established measles infection. However, there's some measures that can be taken to protect vulnerable individuals who have been exposed to the virus. For treatment, after the vaccination, there's serum globulin medications to reduce fever, such as Tylenol and Motrin, antibiotics, and vitamin A. Palliative treatment can be used to ease the symptoms, but does not actually provide a cure. This can be done with antibiotics, vaccines, or any other type of medicine that can help to alleviate the pain of measles.
So some nursing interventions to go along with measles. You should explain the reason for the isolation and use of special vigilance. Explain to parents the importance of immunization. Provide diversion activities. Keep nails short and clean. Give loose clothes to prevent irritation. And avoid exposure to sunlight or heat.
Some complications for measles, or some people may suffer from severe complications such as pneumonia or encephalitis. As many as 1 out of every 200 children, or 20 children, not 200, with measles get pneumonia, which is the most common cause of death from measles in young children. About 1 in every 1,000 infected people could develop encephalitis, which is an inflammation of the brain. And some of the other complications may include infection, bronchitis, laryngitis, or croup cough.
And those are our references.